Florence Ierardi. I am an adjunct professor of music therapy and counseling here in the College of Nursing and Health Professions. I was formerly the program director of the music therapy and counseling program. I am a member of the LGBTQ plus community, and even though that means more than who I live with, who my partner is, I will say that I've been with my partner for 29 years and legally married for 10 years. So that is something that I never thought I would see in my lifetime. You could tell I've been around for a while, but it was kind of shocking and a wonderful surprise that marriage equality came about in 2014 in this country. That being said, sometimes I feel that young people coming up today have an easier time. And as I look into statistics more and mental health among teens in the community, I see that I could be wrong about that. So as it seems like as we gain more rights, it kind of gives some people more, like, it emboldens some people to be more hateful, more openly hateful. So let's say mental health of a teenager has to be affected by the various bills across the country. There are 515 bills across the country where they're trying to make anti-gay laws, anti-LGBTQ laws. And so as a young person, here are these people who are really tasked with caring for them, taking care of them, protecting them, and yet they are attacking them. So young gender nonconforming people can't always use the bathroom that they want to use at school. They are subject to cyberbullying. If their parents are not affirming and accepting, that just compounds the situation. And then if they are a person who lives with other marginalized identities, that compounds everything. So we can see that anxiety and depression and sadly attempted suicide is increased among LGBTQ plus teens, and more so for Black LGBTQ plus people. But what we talk about in class and our program of music therapy and counseling and in the creative arts therapies department, we try to be very much focused on social justice. There's an article that we read in our course called Toward a Queer Music Therapy. And really what that means, the authors talk about radical inclusivity. So really having gender affirming spaces, working with the participants to structure their own safety and say what safety means in those spaces. In music therapy, we try to be aware of musical artists that are role models, Janelle Monáe, Queen Latifah, Ricky Martin. So people who have been open about their identity, that is known to be very affirming for people in the LGBTQ plus community. Even Indigo Girls, Lady Gaga, people who have identified openly as queer, that is affirming for them and increases their safety. Mental health professionals in general, I think this is not so much innovative, but to really be aware of our biases. What did we grow up with? So just always being aware of our biases, and that's part of our cultural competency in mental health. Acknowledging, making efforts to know the perspective of the people that we're working with. Again, especially historically minoritized people, knowing their perspective and then knowing those skills and techniques to work with them. And that idea of radical inclusivity, very important about just affirming the experience of LGBTQ plus individuals, not assuming that everyone who comes to therapy has gender dysphoria, not making that assumption, not pathologizing, but also celebrating people's own identity. Sometimes even just being very aware, verbally aware, aware in groups, discussing, is in itself innovative because it often gets pushed under the rug. And difficult conversations or courageous conversations, I should say, are difficult. And so being open to dialoguing about that. And so we want to advocate for LGBTQ plus individuals, even in the community, but also where we work. If we notice that there's something in our environment that is not affirming or may cause harm to an individual of any minority, we want to be able to speak up for them. So advocacy and action is also very important. In Philadelphia, actually, we have a program called The Attic, which is for teens who identify as LGBTQ+. And it's a wonderful sort of resource for community, for gender affirming, and for just affirming spaces. There's also the Mazzoni Center in Philadelphia, which provides mental health counseling, and as does The Attic. Again, the Trevor Project is a great online space, and in fact, it just emphasizes how unsafe teenagers and others, adults, can be in their own environment, and what it's like not to have your own family, your own caregivers accepting who you are.